House Health Policy will come to order. Would the clerk please take attendance?
Chair Rogers.
Here.
Representatives Whitsett.
Here.
Carter. Here. Hadsma.
Here.
Neely.
Here.
Glanville.
Present.
Kafia. Conlon.
Here.
Farhat. Fitzgerald.
Here.
Miller.
Here.
Rangans.
Here.
Vanderwall.
Present.
Filler. Mueller.
Here.
Van Workum.
Here.
Roth. Schmaltz. Thompson.
Here.
Madam Chair, you have 14 members present. You do have a quorum.
Thank you. Representative Hadsma moves to approve the minutes from our meeting on January 18, 2024. Seeing no objection, the minutes are approved. Prior to testimony and votes, if you wish to speak or express your position on legislation before us today, please submit a card to the clerk. Sergeants in the room will be happy to collect the cards and get them to the committee clerk on your behalf. In the interest of time, you are also welcome to submit written comments to be submitted to the bill record. Today, we will adopt substitutes for HB 5368, 5369, and 4532 before voting to report this package. We will re-refer House Bill 5399 to the Tax Policy Committee. I will also be sending 7 bills to the Behavioral Health Subcommittee. And finally, we will hear testimony on House Bills 4347 and 4348, as well as Senate Bills 57 and 58, which address the availability of whippets. First, we will take up House Bills 4532, 5368, and 5369. We do have substitutes for each bill. I'm going to cover the first 2 bills, and then we'll take questions and read in additional cards. The following so the first changes are for substitute 5368. The following technical changes were requested by the Michigan Department of Health and Human Services. Page 2, line 4A, strike, quote, for case management purposes as it is not needed. And page 2, line 5, strike, 1 or more children not more than 6 years of age and replace with, quote, a minor. So that EBL investigations is for all children, not only children under age 6. Changes to House Bill 5369 were requested by MDHHS. Page 2, lines 10 through 12, strike blood lead level of a child equal to or greater than the elevated blood lead level and insert an elevated blood lead level because elevated blood lead level to make it match language in HB 5368. Page 2, line 14 through 15, strike, quote, whose blood lead level exceeds the elevated blood lead level and insert, quote, with the elevated blood lead level. To simplify language and add clarity, page 2, line 16, insert, quote, less than 3 years of age after child. This is because early on serves children up to age 3, as was mentioned in testimony, and will prevent those ineligible for early on services because of their age from being needlessly referred for an evaluation. Page 2, line 16, strike, quote, whose blood lead level exceeds and replace with, quote, with an elevated blood lead level. Page 2, line 19, strike by January 1 and insert by July 1st. This is to align with the July 1st fiscal reporting called for on page 3, line 2, and use the language, quote, who were confirmed to have elevated blood lead levels in place of the previous elevated blood lead level and 10 micrograms per deciliter. Page 2, line 21, use, quote, less than 6 years of age. This is because blood lead data reported out in Michigan and nationally is typically reported for children under age 6, not age 7. Page 3, line 5, strike previous and insert preceding fiscal. This is to align both the budget and data reports with the preceding fiscal year and to acknowledge that budget reporting aligns with the fiscal year and not the calendar year. The following technical change was requested by MyLeap to reflect that early on is now administered by MyLeap and not MDE. So on page 2, line 18, strike education and replace with, quote, lifelong education advancement and potential. Do members have any questions about the substitutes to House Bills 5368 or 5369? And were there any additional cards on those? Thank you. In support of 4532, 5368, and 5369 is Michigan Association for Local Public Health. 5368 and 5369 is supported by Michigan Association of United Ways, and support for 5368 and 5369 by Forensic Fluid Laboratories in Kalamazoo. Go ahead, call the chair. the H2 substitute to HB 5368. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett,
Yes.
Carter,
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Cuffia,
Yes.
Conlon,
Yes.
Farhat, Fitzgerald,
Yes.
Miller,
Yes.
Rangan,
Yes.
Vanderwall,
Yes.
Filler, Mueller,
Yes.
Van Workum,
Yes.
Roth,
Yes.
Schmaltz,
Yes.
Thompson.
Yes.
Madam Chair, you have 17 yeas, 0 nays, and 0 pass. The substitute is adopted.
And are there additional amendments? Representative Roth?
Sorry, Madam Chair. I do have a amendment to Bill 5368 that we would use the CDC numbers rather than the state going below the CDC. If the CDC is something we can trust, then I think we should be. I need to withdraw that, Madam Chair.
Okay. It is withdrawn. Any other amendments? Okay. Representative B. Carter moves to report out HB 5368 as substitute H2. Madam Clerk, please take the vote.
To report House Bill 5368 with recommendation as substitute H2, Chair Rogers.
Yes.
Representatives Witsett,
Yes.
Carter,
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Cuffia,
Yes.
Conlon,
Yes.
Farhat, Fitzgerald,
Yes.
Miller,
Yes.
Rangan,
Yes.
Vanderwall,
No.
Filler, Mueller,
No.
Van Workum,
No.
Roth,
No.
Schmaltz,
No.
Thompson.
No.
Madam Chair, you have 11 yeas, 6 nays, and 0 pass. The motion prevails.
Moving on to HB 5369, Representative Glanville moves to adopt a H2 substitute to HB 5369. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett,
Yes.
Carter,
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Cuffia,
Yes.
Conlon,
Yes.
Farhat, Fitzgerald,
Yes.
Miller,
Yes.
Rangan,
Yes.
Vanderwall,
No. Sub, yes.
Filler, Mueller,
Yes.
Van Workum,
Yes.
Roth,
Yes.
Schmaltz,
Yes.
Thompson.
Yes.
Madam Chair, you have 17 yeas, 0 nays, and 0 pass. The substitute is adopted.
Representative Glanville moves to report out HB 5369 as substitute H2. Madam Clerk, please take the vote.
Chair Rogers.
Yes.
Representatives Witsett,
Yes.
Carter,
Yes.
Hadsma,
Yes.
Neely,
Yes.
Glanville,
Yes.
Cuffia,
Yes.
Conlon,
Yes.
Farhat, Fitzgerald,
Yes.
Miller,
Yes.
Rangan,
Yes.
Vanderwall,
No.
Filler, Mueller,
No.
Van Workum,
Yes.
pass. Roth,
No.
Schmaltz,
Yes.
Thompson.
Pass.
Madam Chair, you have 11 yeas, 3 nays, and 3 pass. The motion prevails.
To explain the changes to the H5 substitute to HB 4532, we have the bill sponsor, Representative Hood. Representative Hood, thank you so much for joining us today. And please explain the substitute before us. Begin whenever you're ready. Thank you.
Thank you, Chairwoman Rogers, and thanks for the opportunity to address the changes to this bill. The process has worked in the sense that, your questions and the questions of stakeholders have improved the bill, and I hope that it is sufficient to move forward with supporting votes. So we received a change from Laura. Page 6, line 20, the phrase daycare center was changed child care center to align with wording and definitions in legislation around child care centers, PA 116.33. The City of Grand Rapids worked with us on several changes, including on page 15, lines 12 through 15, the definition of, quote, lead-based paint investigation, unquote, was struck from the statute. In line 14, we inserted the words following abatement to define specific instances where clearance exams are to be considered part of the lead hazard control activity. On page 14, lines 22 through 23, we reestablished the definition for a lead hazard screen, meaning a limited risk assessment activity that involves limited paint and dust sampling. And this language is consistent with the federal statute 24 CFR 35-110 and language and work standards in 23 other states. Page 12, line 4, the following definition, dust sampling technician was a bit of a tennis ball in a match, but we finally did land on the following definition. Means an individual who has completed an approved training course and been certified by the department under this part to conduct optional dust sampling following renovation, repair, painting, and other activities pursuant to 40 CFR 745 subpart E. A dust sampling technician is not permitted to conduct clearance after abatement activities. We also included some recommended changes from DHHS, page 2, line 3, striking the word permanently. The goal was to bring interim controls under the umbrella of abatement so DHHS can have authority to regulate those temporary measures that better protect public health. This involves moving interim controls out of subsection 2 and into subsection 1. Sorry, there's a lot of detail here I'm wading through. And then a few other portions that were removed on page 17 and page 14 to align with new abatement definitions and other critical definitions as well. Is that sufficient?
Thank you. Are there any questions from members of the committee? Seeing none, Representative Reingans moves to adopt the H5 substitute to HB 4532. Madam Clerk, please take the vote.
Chair Rogers?
Yes.
Representatives Witsett?
Yes.
Carter?
Yes.
Hadsma?
Yes.
Neely?
Yes.
Glanville?
Yes.
Cuffia?
Yes.
Conlon?
Yes.
Farhat? Fitzgerald?
Yes.
Miller?
Yes.
Reingans?
Yes.
Vanderwall?
Yes.
Filler? Mueller?
Yes.
Van Workum?
Yes.
Roth?
Yes.
Schmaltz?
Yes.
Thompson?
Yes.
Madam Chair, you have 17 yeas, 0 nays, and 0 pass. The substitute is adopted.
Representative Reingans moves to report HB 4532 as substitute H5. Madam Clerk, please take the vote.
Chair Rogers?
Yes.
Representatives Witsett?
Yes.
Carter?
Yes.
Hadsma?
Yes.
Neely?
Yes.
Glanville?
Yes.
Cuffia?
Yes.
Conlon?
Yes.
Farhat? Fitzgerald?
Yes.
Miller?
Yes.
Reingans?
Yes.
Vanderwall?
No.
Filler? Mueller?
No.
Van Workum?
No.
Roth?
No.
Schmaltz?
No.
Thompson?
No.
Madam Chair, you have 11 yeas, 6 nays, and 0 pass. The motion prevails.
Proceeding to HB 5399, we will be referring this bill to the Committee on Tax Policy. Representative Conlon moves to re-refer HB 5399 to the House Committee on Tax Policy. Madam Clerk, please take the vote.
Chair Rogers?
Yes.
Representatives Witsett?
Yes.
Carter?
Yes.
Hadsma?
Yes.
Neely?
Yes.
Glanville?
Yes.
Cuffia?
Yes.
Conlon?
Yes.
Farhat? Fitzgerald?
Yes.
Miller?
Yes.
Reingans?
Yes.
Vanderwall?
Yes.
Filler? Mueller?
Yes.
Van Workum?
Yes.
Roth?
Yes.
Schmaltz?
Yes.
Thompson?
Yes.
Madam Chair, you have 17 yeas, 0 nays, and 0 pass. The motion prevails.
House Bill 5343 through 5347 were introduced and referred to the Committee on Health Policy in November of 2023. It is my intention to have Chair Braybeck and the Behavioral Health Subcommittee work on these bills. Madam Clerk, please read in the provided letter.
Letter dated February 6, 2024. Dear Madam Clerk, on November 14th, 2023, House Bills 5343, 5344, 5345, 5346, and 5347 were referred to the House Committee on Health Policy. These bills provide deadlines for making a determination in mental health and substance use disorder providers applying for status as a participating provider with an insurer and amends annual reporting requirements. I am asking the Subcommittee on Behavioral Health to review and make recommendations to these bills. With ongoing workforce issues in our state and a lack of behavioral health providers, ensuring timely decisions of whether to add a provider to an insurance network is vital. I am confident that the subcommittee will be successful and productive. Sincerely, Julie M. Rogers, Chair, House Committee on Health Policy.
Thank you. Additionally, House Bills 5371 and 5372 were introduced and referred to the Committee on Health Policy in November of 2023. It is my intention to have Chair Braybeck and the Behavioral Health Subcommittee work on these bills as well. Madam Clerk, please read in the provided letter.
The letter is dated February 6, 2024. Dear Madam Clerk, on November 14, 2023, House Bills 5371 and 5372 were referred to the House Committee on Health Policy. These bills require MDHHS to implement a payment system to support our certified community behavioral health clinics, CCBHCs, under a federal 1115 Medicaid waiver. I am asking the Subcommittee on Behavioral Health to review and make recommendations to these bills. CCBHCs have proven to be a phenomenal model for integrated physical and behavioral health care. I am confident that the subcommittee will be successful and productive. Sincerely, Julie M. Rogers, Chair, House Committee on Health Policy.
Now we will have testimony on House Bills 4347 and 4348, as well as Senate Bills 57 and 58. Addiction issues have been crippling our state, and these bills take significant steps to prevent access by minors to products which are dangerous when abused. To speak to the bills, we have Representative Price and and Ellen from Senator Chang's office. And from the Detroit Police Department, we will have Officer Alexis Kellogg and Commander Shelley Holderbaum, who will be joining us remotely. Then, with the Whip It Wipeout Coalition, we will hear from Sylvia Guckin and Brandy Watts. From the Detroit Hispanic Development Center, we will hear from Goya Diaz. Finally, we will hear from Dr. Varun Vora, head of poison control for the state of Michigan. To kick us off, we have Representative Price and Ellen joining us, and we will take some questions after they give testimony. Welcome to Health Policy.
Thank you. Thank you, Chairwoman Rogers and Minority Vice Chair Vanderwall. Thanks for taking up these bills. My name's Ellen Heinitz. I'm the Chief of Staff for Senator Stephanie Chang. In 2018, while they were still in the House of Representatives, Senators Joe Bellino and Senator Chang passed legislation that prohibited the sale of small nitrous oxide containers known as whippets to minors, and to institute a fine for stores who failed to check for ID. In the past few years, Senator Chang has worked with law enforcement and community groups in Detroit, such as the Whip It Wipeout Coalition, and it's become clear that instead of minors, adults are now abusing whippets at higher rates. Because whippets have a legitimate use in food preparation and baking, limiting their sale further isn't feasible or appropriate. But to ingest the nitrous oxide to get high, first it must be released from a container. These are the containers. Using something called a cracker. This is a cracker. The only purpose of these crackers is to release nitrous oxide from a cylinder, often into a balloon, in order to inhale it. I'll show you that in a minute. Whippets have become a popular recreational inhalant of choice, with over 12 million users in the U.S. who have tried it at least once, according to the Substance Abuse and Mental Health Services Administration. inhaling the compressed gas either from a balloon, a whipped cream canister, or just a big nitrous tank that some of our other people will testify about, results in a fleeting high that lasts anywhere from a few seconds to a few minutes. Altered perception and motor coordination caused by nitrous oxide intoxication have been a significant cause of motor vehicle and other accidents. Because the whippets and crackers are small and portable, you can just stick this in your pocket, abusing them while driving is easy to do. Law enforcement officers and business owners report that some cars will pull up to a stoplight or a parking spot and discard a dozen of these used whippet containers at a time. Senator Chang's bill, Senate Bill 57, and Senator Bellino's bill, Senate Bill 58, will specifically prohibit the sale or offer of sale of an object specifically designed for inhaling nitrous oxide for recreational purposes, thereby prohibiting stores from selling these crackers. These bills were written in a way that will not interact with or affect any municipal ordinances in Michigan that criminalize paraphernalia possession. Our intent is not to criminalize those abusing whippets or addicted to whippets. It's instead to limit the access and to try to improve public health outcomes. The Whippet Wipeout Coalition in Southwest Detroit averages 5,000 whippets in a collection week. In 2020, during a 6-week collection campaign, they collected over 30,000 canisters and recycled them. In 2021, during Motor City Makeover, 11,000 were recycled. Team Chang has participated in whippet cleanups and been just astounded by the amount that you can collect in just one day. For more on the effects regarding public health and concerns from law enforcement, I think Chair Rogers did an admirable job of letting people know. So I will turn it over to you.
Thank you, Chair Rogers, for inviting testimony on this important issue. We need to prohibit devices for recreational nitrous oxide use, also called whippets. I also want to thank Senator Chang and her team for the tireless work on this issue, and Senator Bellino and Representative McKinney for their advocacy and efforts in this space. I feel very honored to be included as part of this package. My husband is an emergency physician in Wayne County. He sees firsthand the devastating, debilitating impacts of whippets on his patients. And today we will hear from another provider, Dr. Varun Vora, a clinical toxicologist and the director of the Michigan Poison and Drug Information Center. Dr. Vora will explain how whippets harm the body. He'll demonstrate the alarming rise in whippets use. He'll provide evidence that the impacts for this harmful trend spread clear across our state. We'll also hear from residents who have directly experienced harm from whippets on their loved ones and on their communities. And as stated, our intent with these bills is not to criminalize the use or the possession of whippets. We do not want to do anything to dissuade people who are suffering from addiction from getting the help that they need. Instead, these laws seek to prohibit the sale of the objects designed for abusing nitrous oxide. By reducing the sale of these devices, we hope to curtail illicit drug use and protect our communities from their catastrophic effects. I want to thank everybody here today for providing and for listening to this testimony and for spreading awareness that whippet use is dangerous and a clear threat to all of our communities. Thank you.
Thank you. Do members have any preliminary questions? Otherwise, we have a lineup and we can come back to questions. Okay, thank you so much. So I think starting us off is Detroit Police Officer Alexis Kellogg, followed by Commander Shelley Holderbaum. And I think they're remote. Hi, welcome to Health Policy. Begin whenever you're ready.
Good afternoon. Yes, my name is Officer Kellogg from the Detroit Police Department. I work in the 4th Precinct, which encompasses Southwest Detroit. When I was in patrol, starting probably around 2018, 2019, our shift started noticing a large volume of, I believe she showed a sample of the smaller nitrous cartridges, the silver ones. In 2020, I joined the Whippet Wipeout campaign just to get a better understanding of what we were finding. Because I personally wasn't aware of what we were looking at. And since then, I've been kind of the eyes and ears for this community for the campaign. I would say 2020 to 2021, maybe 2022, we started transitioning from the smaller cartridges to these larger tanks, which we are now, our streets are littered with. And as you can see, I don't know if you can see in the Zoom, there's a tip on this tank. It's around a foot long. This would be deemed the accessory that you can then ingest and inhale nitrous oxide. This has now replaced the smaller cartridges. On any given day, I can collect between 50, maybe 100 of these. Mostly they are in our parking lots and surround our parks, or discarded just anywhere on the streets. They're a hazard for driving and our environment. In 2023, our city law department sent out an internal memo also advising us on noticing an increase of cases that were involving individuals huffing this while they were driving, where we've seen accidents, fatal accidents, cars crashing into buildings and whatnot, with people using these or ingesting nitrous oxide while driving. Currently, we probably have between 20 and over 20 locations in our small area that sell this product and the accessory in our gas stations and public stores. So I just am trying to continue awareness to our community and our officers about this problem. And we're looking for some assistance in seeking to prohibit the sale of this and supporting this bill.
Thank you so much for
you.
your testimony, and thank you for the visual. We could see it. Next, we have Commander Shelley Holderbaum. Hello, welcome.
Hello, good afternoon, everybody. Can you hear me?
Yes.
Okay, great. Since my assignment here at the 4th Precinct in March of 2023, I have participated with the Whip It Coalition, and I had no idea coming from another part of the city just how bad it was and how much it affected Southwest, but it is growing. We have great challenges here regarding addiction as well as crimes being committed. Folks are getting the resources to purchase them as well as stealing them from the stores too as well. And it's truly, the quality of life issues when we're trying to deal with the cleanup. They are being dumped everywhere. They are noticeable. People are using the whippets while they're driving, which are causing a lot of accidents. We're having a lot of accidents, and when we make the scenes, the whippet cans are definitely inside the vehicle to itself, which does, I believe, cause the folks using them to pass out. But the most concerning thing is when parents bring them into the precinct, because a lot of our parents don't understand what it is. And they bring it in and they'll show it to, the officers on the desk. And so we do know that the children are getting these and they are using them, and it's very concerning. So we are asking that you truly support this bill because it's much needed. Thank you.
Thank you. Do members of the committee have any questions for law enforcement? Representative Thompson.
Thank you very much, and I appreciate your concern for this terrible trend in addiction for children. I was curious, you talked a lot about, you said 50 to 100 of these bottles, these whippet containers that you're finding throughout the community. How many needle syringes would you say that you're finding throughout the community with regards to other drug use paraphernalia?
Representative Thompson, we're talking about the bills at hand, so please stay focused at the bills at hand, which are regarding whippets.
I think it absolutely totally correlates, because we have seen bills come before our committee where we are legalizing the use of needle exchange and promoting needles, but we're not trying to criminalize the addict. So I'm kind of trying to get a feel for what we're doing here, because it seems like we're going both ways on this.
Commander, if you have a ready response, but if you don't, I understand.
Is there a large number of needles that you're picking up in your streets and in your parks and in your communities from IV drug abuse?
I'm not going to say we don't find needles, but I think the true difference is these canisters are big and they're noticeable. So of course, we find more than what we do find with the needles because of the fact that they are so noticeable.
Thank you.
Um,
Are those containers reusable at all? It's a one-time use container? Okay, thank you very much.
Thank you. Representative Roth.
Are there any other canisters of any kind that are being abused or misused that have caused issues?
I mean, I don't know if you're asking them or if you're asking me, are you,
Go ahead, Ellen.
I'm
I'm trying to think of it. Yeah,
There's
some-
different sizes of these.
But they're all contained with nitrous oxide. I'm just trying to think if they're using some other kind of things to watch out for that they could manipulate or abuse that could cause actual physical harm other than the noticeable harm that these do.
I think that similar types of cartridges are sold with like CO2 in them that can be used in like little race cars, yeah, and paintball guns and stuff. But you can't get
Can't
high from
misuse them.
those.
Got it.
Yeah.
Yeah. Thank you.
But these, you'll see them in a gutter. Actually, they cause problems for people riding bikes, people pushing strollers. The whole way that Senator Chang got interested in this topic back in 2017 was because she was knocking on doors in Southwest Detroit, and she kept seeing these in the gutter, and she didn't know what they were. So she asked a community member, and that's what she was told.
Yeah. Thank you.
Thank you. Moving on to the next set of testifiers, Sylvia Guckin and Brandy Watts from the Whippet Wipeout Coalition. Welcome to Health Policy. Thank you for joining us. Good afternoon.
There we go. Red light's on. Going to tell you a little bit about how the Whippet Wipeout Coalition came to be. And it was in July 2020 when we returned to our offices in Southwest Detroit. We noticed a difference in our street and walking environments. There were thousands of these small whippets in our streets that actually looked like it rained whippets. And the chairman of our company, the Ideal Group, Frank Venegas, has worked for years to raise the education level and clean the neighborhoods in Southwest Detroit. We've worked with our community organizations to make it a safe place to live and for children to grow and learn. And he was very upset. So we reached back into our young community leaders at Detroit Crystal Ray. There were 4 alums who were in college, and they helped us organize a 6-week cleanup to see just how bad this was. And within the 6 weeks, they collected over 25,000 to 30,000 of these small containers, this small container. And then we looked into why this was happening. And this was happening because, number one, they could go to the local store and get it and have a short high. They didn't have to deal with the drug dealer. That was number one. And number two, it was FDA approved. So in some people's minds, it's a safe drug. And number three, the recreational users, many of them have been to the dentist office and they have had nitrous oxide at the dentist office, and they're not aware that it's mixed with oxygen, and there's a technician or an administrator there making sure that that patient is safe for the survey. And those were the things that we learned about this. And we began the coalition after the 6-week study, and we called upon our city, our nonprofits, and our schools and our churches to join us. And within a short period of time, we had over 20 organizations combined to sending members for the coalition. We met by Zoom monthly, and in that period of time, we got City Council's attention. The city passed an ordinance banning the sale of nitrous oxide, these small containers, to minors. And then we also realized and learned that we were standing on the shoulders of Senator Chang's group in 2017 passing the law. So we reached back to some of our more senior community leaders to help us with this. We had a 2-year education campaign. We, City Council, Detroit City Council declared National Whippet Week, where we raised awareness every day of the week of a different health aspect of whippets. So we have done a lot with a little. We have been funded by some business, but we have not had any major donations. This has all been by the will of the people. And with that, I would like to turn you over to Brandy Watts, who now leads the Whippet Wipeout campaign and is going to tell you what we're doing. Thank you.
Thank you. Thank you, Sylvia, and thank you, Madam Chair and Health Policy Committee members. Again, my name is Brandy Watts. I'm part of one of the nonprofit organizations that Sylvia mentioned before, Southwest Detroit Business Association, and we have taken over, or not taken over, lending our support in the Whippet Wipeout Coalition, and mostly focused on, moving the needle. I won't reiterate, Sylvia, in the interest of time, but we've talked about the dangers of whippets and what it's doing to the community, and the implications of this legislation would extend way beyond the realm of the substance misuse prevention. The passage of these bills presents an opportune moment for us to continue to address the pressing need for a comprehensive transportation and disposal plan for all these whippets that we've been collecting. Improper disposal of these containers poses also a huge threat to those that have to deal with the emptying of the full emptying of the cartridges. Improper disposal also is an environmental hazard. From soil contamination to water pollution, as we sat there littering the gutters. Moreover, those tasked with handling the disposal, as I said, have exposure to hazardous substances, and this is underscoring the urgency of us implementing a more viable transportation and disposal strategy. So by supporting this legislation, you not only demonstrate, a commitment to the public health, but it also allows us to pave the way for a more broader conversation on the environmental stewardship and the responsible waste management practices that need to still also happen. We can collect all day, but if we don't have a viable plan to dispose in a safe manner, it really becomes, another task. But this legislation will help us have those conversations and move that needle along, and bring more attention to this issue. We thank you for hearing our testimony, and we're open for any questions that you may have.
Thank you. Do members have any questions? Representative Glanville.
Good afternoon. Thank you so much for being here today and for sharing your testimony and bringing forward this important piece of legislation. I'm just curious, are there legitimate uses for nitrous oxide, and what are some of those, aside from the dentist office?
The product is sold to use to make whipped cream. And by the amount of waste material that we're seeing in Southwest Detroit, it looks like we should become the whipped cream capital of the world, but we are not. So that is, it is an FDA-approved product. You can buy it on Amazon. It is, you can buy it by the case, and some Some dealers do buy it by the case, and they take it to dance parties and sell them there per cylinder. So it's easy to get. If you have an Amazon account, you can have cases delivered to your door, and nobody's going to know but you and Amazon. And in our local stores, they now have this product out front, and they're selling them for, these now go 3 for $1. This container equals about 50 of these, so they amped up the danger of the nitrous oxide health damage, and the big one is 100 or over, depending upon the size.
Thank
And-
you.
Can I
Hope that answered your question.
follow up? I apologize, I don't have the bill in front of me, so maybe I just need to take this offline, but I'm just curious, trying to understand the line that might be drawn between a legitimate seller and recreational use. I mean, I can imagine this isn't a product you need to have in a gas station, but maybe in a grocery store.
Representative Price.
Yeah, so these bills are intended, and it's clear in the language of the bills, that it is criminalizing the sale of these products knowingly for recreational use. And when we see them marketed in gas stations and convenience stores, it is clear, and it's up to the judge to decide, but it is clear that there are knowing sales intended for recreational use, which is what these are intended to curtail.
Okay, thank you.
Vice Chair Whitsitt.
I guess I'm also trying to, because I haven't looked at the bill, so please excuse me. But how do you plan on kind of like trying to regulate something like that off of an Amazon? I mean, I know like with taser guns, you can't purchase them off of Amazon. You have to purchase that locally. So how would you do something like that?
So these bills don't regulate the sale of these canisters full of nitrous oxide because they have legitimate uses that would be very difficult to do. What they do is make it illegal for a store to sell anything whose only purpose is to open canisters of nitrous oxide. So you can't go into a store and buy this cracker. You can still get nitrous. We're just going to make it harder for you to be able to get access to it. We're adding it to the section of law that deals with drug paraphernalia. It's the same reason why there were certain things you couldn't buy in stores or had to be called something else when they were dealing with an illegal drug.
Thank you.
And
All right.
I would like to add, please, I did have an expanded testimony that I added to this. And on this, you will see a resource list on the back page. And we did not have the opportunity because of time today.
We
to
have
show-
uploaded it, so it is on the web. We have
Okay.
that. Thank you so much.
Very much.
All right, with the Detroit Hispanic Development Center, we are joined by Goya Diaz. Welcome and begin when you are ready.
Good afternoon. I just wanted to share with you, I am a resident from Southwest Detroit, and I'm also a member of the Wipeout Coalition, which I've been very involved for the past 2 years. We actually been doing awareness to let people know in our community what is an actual whippet. You know, we've been working with parents, small children, teenagers, people from 40 years old. Some did, especially the parents that I've been working with, never even knew what this was. They actually told me, I've seen that in my kid's room, but I told them what it was for. They didn't understand what that meant. I guess they compared it like to marijuana because marijuana smells. Unfortunately, this does not smell. And this high that they get, it's 30 seconds. I mean, so that's why they're using so many. That's why they're getting these big containers. And that's one thing that I let the parents know what it is and how harmful it is. And again, they don't just use one and just drop it. They have to use multiple. And unfortunately, the more that they use, the more harmful it is. I actually have a goddaughter is 17, and her parent didn't even know she was using it. She was using at least 2 of these containers, which somebody will go get it from the store for her and will be using it in her room. The only reason that the parent knew that it was there because she literally went under the bed, finally cleaning her room, and she's seen all these canisters, and she's like, what is this? Which she ended up finding out that her daughter was doing this. Not only that, the more reason how she knew, her daughter wouldn't get up from the bed. And then, so the mother was very, very concerned, like, what's wrong? Are you sick? And she would say, oh, it's just because I don't feel well. The reason why she wasn't feeling well is because she's inhaled so much of these that her body couldn't react to, her nerves got affected by this oxide, with these gases. So even the mother being there with her every single day, not even knowing that this young lady was inhaling this. So that's why we wanted to make sure to, I'm here to help educate our parents, our youngsters, because again, the younger they are, the younger, unfortunately, they're out there trying to get high, a quick high, like they say, and this is a quick high for them, and something that they can't even smell. Okay.
Thank you.
For your time.
Thank you. We have a question. Representative Miller?
Yes, thank you. I remember getting nitrous oxide as a child going to the dentist. You could have put needles in my eyes, I would not have cared one bit. It is so powerful. Those cartridges there that you have on display, what is that used for if they're being sold? What's the purpose, what's the intended purpose of those? It looks like caulk. What is that?
Exactly. It's intended to do whipped cream, to expand the whipped cream. That's exactly why it's FDA approved. But instead, they are selling these in our neighborhoods, dollar stores. I literally, 2 weeks ago, I went into the dollar store by my house. They're literally right there on the front counter. They are selling these small ones, 3 for $1.
Thank you. Are there any other questions? Okay, so we have supporting all the bills, Michigan Nurses Association, and support for the 4 bills listed below is Families Against Narcotics. Oh, I'm sorry. That's right, Dr. Veron Vora, Head of Poison Control for the state of Michigan.
Dr. Vora has a PowerPoint. Are we able to get that up on the screens?
Aware of a PowerPoint. We are running close on time, so I
have a USB too, if that helps.
I
apologize, Chair Rogers.
Go ahead, Ease, call the chair.
Yes.
Yeah.
That's it.
Right. Thank you, Representative Rogers, and distinguished members of the committee for allowing me to present today. I'm going to give you the perspective of the Michigan Poison and Drug Information Center, at least what we're seeing. Kind of a primer on what we do. We are the state's only poison center right now, so we operate 24/7, 365, serve the entire state, including the UP in northern Michigan. Our staff is comprised solely of licensed healthcare providers, either RNs, PharmDs, MDs, including clinical toxicologists like myself. I probably should have started with that. My name is Varun Vora. I'm a clinical toxicologist and director with the Michigan Poison and Drug Information Center, assistant clinical professor as well with the Department of Emergency Medicine. So our staff is comprised of licensed healthcare providers with education, outreach, and clinical treatment and management of patients as well. So what we do, we triage, we diagnose, we treat actual poisonings, exposures to you name it. Anything can be toxic depending on the dose. We educate the public. We keep people out of hospitals with unnecessary hospitalizations. unnecessary admissions to the hospital. We decrease length of stay by optimizing treatment of poison patients, so we save a lot of healthcare dollars. We annually, about 60,000 calls we handle a year. So when it comes to nitrous, I know it's been repeated already, so it is widely available. Gas stations, head shops, vape shops, smoke shops, etc. So it is for whipped cream. Also, the bigger canisters are used for fuel boosting as well for in the motor industry. So you'll see like those Fast and Furious type cars, they use those to boost their fuel. But that perception that it's so widely available, it's a misperception that it is harmless, when in fact that's not the case at all. So these were photos that we actually took of gas stations, so you can see how readily available those canisters are by the dozens right there on the right. So from a clinical perspective of what it actually is doing, essentially it inactivates vitamin B12. So I know an earlier speaker mentioned that it does cause basically neurotoxicity or damage to the nervous system. So what it's doing is it's basically inactivating vitamin B12, which is crucial for key enzymatic processes to prevent or develop, synthesize methionine, other enzymes, which essentially are needed for DNA synthesis and myelin production. So basically the myelin sheath of your neurons. That helps neurons transmit impulses quickly and efficiently. So basically B12 is there, but it's inactive. It's not doing its job. So what we have is basically symptoms with weakness, paresthesias or pins and needles feelings, mostly in the hands and feet, which work its way centrally to the trunk of the body. And then it works its way to spinal cord degeneration or frank paralysis, so which can be irreversible. So it can be extremely devastating. So you have the inhibition of these key enzymes. So from a poison center's perspective, our role, we collect a lot of toxical surveillance data. So when we've queried nitrous oxide cases that have been called into us over the years, we can see a pretty dramatic increase. And mind you, poison center data has limitations with being reliant on passive voluntary self-reporting from either providers or users. So this is kind of a nuanced diagnosis, but the numbers are going up. But to corroborate these, and these are where the calls are coming from. So again, this is just from this past year to the Poison Center. So you can see that there's a lot of Northern Michigan. Calls have come in from the UP as well. But we've had Michigan syndromic surveillance data with my work with the state epidemiologists as well. And as you can see, in 23, there's been over 130% increase in nitrous oxide misuse. And this was up until November of last year, so surely it's been higher when you include December. So that exceeds the entire total from all of 2022. Up until November. Wayne, Oakland, and Macomb counties were the main counties where this was happening the most. But again, we do get calls. I'm on consultant call today. Poetically, I got a call about nitrous on my way here, which is really interesting. So these are the counties with the highest prevalence right now, but we are seeing it more in northern Michigan, mid-Michigan. Not to anyone's surprise, it's the misuse is highest among younger people between 20 and 40 usually, again, also younger in high school. It's becoming more and more popular at festivals and raves and dance parties as well, as was mentioned. And beyond the physical, the actual paralysis, which can be irreversible, we have also neuropsychiatric effects. And this was a paper that recently came out from colleagues of mine overseas with long-term psychiatric effects, including depression, suicidal ideation, mood changes, and that's owed to reduced cerebral perfusion, causing brain atrophy over time. So it's a huge, basically brain damage in short, simplest terms. So that's why on behalf of the Michigan Poison and Drug Information Center, the toxicologists and the staff, we do support Senate Bills 57 and 58 to limit the use and sales of the paraphernalia associated with nitrous oxide. I will say, inhaling nitrous oxide directly from the whippets can be unpleasant because it can cause frostbite injuries as well, which is why people use them to pierce. So use the crackers to pierce it and then release it into a balloon. So it's a less irritating way of inhaling it. So this could go a long way in mitigating injury. And with that, I'll take any questions.
Thank you. Do members have any questions? Thank you so much for your testimony.
Thank you.
Thank you to everyone for joining us today. Please let the bill sponsors and my office know if you have any suggestions or concerns with the bills that were heard in testimony. Representative Hodsma moves to excuse absent members. There being no objection, the motion prevailed by unanimous consent. There being no further business before the committee will stand at adjournment.